Okay, so Sujay is asking that what is Lazarus sign in brain dead patient and what is the significance. So understand that in a brain dead patient, all the cortical functions are lost and all the brainstem functions are lost. It means there is no function in the midbrain pons medulla. The patient is completely apneic and the patient is brain dead. So in a brain dead patient, you expect that the patient should not move, there should not be any movement. But it happens at times when you are testing the patients or moving the patients or examining the patient, suddenly the patient moves both upper limbs like this, flexes both the arms, forearms, and it may cross over also. So it may feels that the patient is trying to remove the endotracheal tube for that matter. So this is Lazarus sign, and it is not a sign of the brainstem or the central nervous system. It is a spinal reflex, more specifically from the cervical spinal cord. And the literature says that those patients who had suffered a spinal cord anoxia in terms of hypotensions like that, these patients have more chances that these patients may develop Lazarus sign. So what is the significance? So you should know that flexing of both the arms and crossing over like this or other movements are the spinal reflexes. This means that patient is still brain dead, and these are not the signs of brainstem functions or the central nervous system. So how to differentiate? So one method is you give the pressure of pain or noxious stimulus at the central points like supraorbital notch or temporomandibular joint. In such cases, the patient will not move. But you move peripherally, like turning of the neck like that, sometimes the patient may flex. So you are sure that it is coming only on spinal level, not at the central level. So I had a small video which I found in the internet, and I'll show you for that matter. In that video, firstly, it is coming by flexing the neck, and when the physician is giving the pressure at the central points, the patient is not moving. So this is how you can differentiate to some extent. So here you can see that as soon as the patient neck is moved or flexed, both the forearm get flexed, and it seems like patient is trying to remove the endotracheal tube. So this is Lazarus sign. Now, but to differentiate, what they will do is they will give at the central pressure points, pressure at the central pressure like supraorbital notch. They can give pressure at the temporomandibular joints also. In fact, they can give very deep or noxious stimulus at the manubrium of the sternum, as you can see they are giving now. Still the patient is not moving. That means the patient is brain dead. It was a peripheral spinal cord sign. Now again, when the neck is flexed or moved, the patient will move for both the forearms. So patient is brain dead and it's a spinal sign. Do read more about it. Thank you.